1,000 tests to 8 p.m. last night, which is always a pleasing result, and we're so grateful people are coming forward to do the right thing. We had 415 cases of community transmission, so a welcome drop from yesterday, but obviously much more work to be done. We just ask everybody to please stick to the rules, stay home, get tested if you have symptoms, stay home again until you get the results, and of course come forward and get vaccinated. Of those 415 cases of community transmission, at least 35 were infectious in the community, and that number is likely to go up as cases under investigation are consolidated. Regrettably, 4 people lost their lives to 8 p.m. last night. A female in her 50s from Western Sydney at Campbelltown Hospital who wasn't vaccinated. A female in her 70s at Royal North Shore Hospital who was only recently given her first dose, so wasn't protected. A man in his 80s at Liverpool Hospital who wasn't vaccinated. A female in her 80s at RPA who was vaccinated but did have underlying chronic conditions. Again, our heartfelt, deepest sympathies and condolences to all of their loved ones. Please know the last thing we want to see is more deaths because of this outbreak. But unfortunately, we know that's what we're going to see unless we reduce case numbers and unless we increase the rate of vaccination. In relation to where the most concerning areas are, they remain, of course, in Western and Southwestern Sydney. We've seen stabilisation and reduction in some local government areas where there's been that intensive activity and increasing rates of vaccination. But the main suburbs that we're now concerned with, which are showing considerable growth in cases, and please know if you're in these areas, you need to not only take extra precautions, but make sure you come forward for testing and stay home. Do not leave home unless you absolutely have to. That's Blacktown, Mount Druitt, Marryong, Merrylands, Auburn and Guildford. These are the suburbs of most concern in the entire state. And we really need people to stay home. And the only reason you should really be leaving home, unless you absolutely have to get an essential food product, is really to get vaccinated, and that's it. And can I also make comment, and the Deputy Premier is here, and thank him for his support in relation to our regional New South Wales strategies, that there is stabilisation in the Hunter region, which is positive, but Western New South Wales remains a concern, especially in relation to our vulnerable Indigenous communities, and getting vaccine to them is critical at this point in time. On a very positive note, New South Wales hit 5 million jabs. Thank you, everybody, for coming forward to get vaccinated. Outstanding result that in New South Wales we now have hit 5 million jabs, and 50% of our population has received their first dose. So that is a very pleasing result. Thank you. If we keep that up, we can look forward to hitting those vaccine milestones, hopefully on the schedule that we have, but if we do really well, obviously that can happen more quickly. I was very pleased with the announcement the Prime Minister made shortly before this press conference to say that New South Wales will be receiving an additional 500,000 doses of Pfizer. Please know we'll be putting that to very good use. We'll be targeting 16 to 39-year-olds in those local government areas of concern. They are the ones that are mobile because of their work. They are the ones who cross 3 generations, and they are the ones who are part of the 70% of cases that we're currently experiencing in those most problem areas. So I'm very pleased with that, and please know those will be going to good use, and that is in addition to the 100,000 we'd already allocated for authorised workers this week. And today is our big construction worker and tradie day. So we're hoping that at least 10,000 people will get vaccinated today, specifically in the construction and tradie occupations. But of course, commencing Monday and over the next 2 or 3 weeks, we'll have a bumper run of vaccinations. And I'm pretty convinced that the week of the 16th and the 23rd of August will have the highest rates of vaccination our state has seen. So it's really pleasing that we're getting those doses up. But can I stress to people, please come forward and get vaccinated. Don't be too fussed on what vaccine you're offered. But obviously certain ages, especially those who are 16 to 18-year-olds, can only take one type of vaccine. But don't be fussy. Get your hands on whatever vaccine you can and please get vaccinated. The quicker we hit those targets, the safer our community is and the greater opportunity we have to reduce the spread. Thank you. Now I'll ask Dr Chant to give her update. The Deputy Premier will say a few words, as will Deputy Commissioner McWilling, and then we'll take the questions. Thank you.
There were 415 locally acquired cases reported in New South Wales in the 24 hours to 8 p.m. last night, and 2 overseas cases. These case numbers are too high. We need to see these case numbers go down, and we all have a part to play. I can't stress enough the seriousness of the current situation and my grave concerns that these case numbers will continue to escalate. Whilst we have put in additional controls, everyone needs to have a great sense of responsibility to follow the rules. I understand how hard it is that we've been into this lockdown for such a prolonged period. But the risks we bear if we do not continue to follow the spirit and intent of all of the public health orders. Please stay at home and do not leave home unless for the most essential reasons. Sadly, we have 62 people in ICU, and sadly, the Premier announced the 4 deaths. I personally do not want to see escalating numbers of deaths and hospitalisation, and it does require all of us to act and adhere urgently and not have any degree of complacency, even though we all feel it after such a protracted battle against COVID and the pandemic, which has been going on for a long time. In terms of the risk areas, I'm very concerned about Western New South Wales. We have cases in Dubbo, cases in Walgett, and we have exposures and sewage detections in a number of other areas such as Burke. I'm concerned that we up our vaccination rates and we up our testing, and that we again have very strong compliance with the requirements to stay at home. On a more positive front, it is pleasing to see things settle in in the Newcastle area, but the public health unit still remains concerned, particularly around the Maitland area, and there were some cases that they've investigated overnight. So please, if you are resident in the Newcastle area, please be vigilant for those local concerns notices. In terms of northern New South Wales, we have a detection in the Lennox Head sewage treatment plant, and again we've had very reliable results from our sewage, so it does make us call out the community for testing. And in Sydney, we've had the Wallacia sewage treatment plant, which serves Warragamba, Mulgoa, Silverdale and Wallacia, test positive. And again, the Burke, which reflects my concern around Western New South Wales. In terms of my key messages, is that it is incredibly pleasing that the Commonwealth have procured additional vaccines for us, and I'm very grateful to the efforts of Dr. Murphy, the Secretary of Health, and our colleagues in the Commonwealth who have worked so diligently to facilitate that access to that vaccine. We need to use that vaccine in a very targeted way. We are targeting it to the younger age groups because we know that they are the predominantly driving the spread. Those younger people are the people that are going out and working in disability homes, aged care homes, childcare, logistics, freight. And so this will be an intense effort to get one dose of vaccine into that group as quickly as possible. But there is no silver bullet, and vaccination is not a silver bullet. It's a tool. And vaccination alone will not get us out of this situation. We need to follow the public health orders. And my message to everyone is let's redouble our efforts for the next couple of weeks, get those case numbers down, stay at home.
Well, thank you. Can I also start by passing on condolences to those families that overnight lost loved ones in this recent outbreak. Yesterday we made the decision to lock down regional and rural New South Wales, and confronted with the data and the information from the health team and the crisis cabinet at midday yesterday, we worked through that detail, and it was clear that the safest and most precautionary approach for regional and rural New South Wales was to go into a 7-day lockdown. This will allow us to work through the detail and the data with, as we've heard from Dr. Chan, especially through sewage surveillance, to make sure we stay ahead of the curve. We've known and we've seen already with what we did in Orange, a sharp, hard lockdown early has meant that we've seen freedom come back to regional New South Wales even sooner. Western New South Wales continues to be of concern, especially in Dubbo and in Walgett. 21 cases overnight and 9 still in the community, and that is of concern. The Hunter New England, of course, we're seeing stabilisation, but still 9 cases, and we're focused on Maitland. The Central Coast, 2 cases, 1 in the community, so again of concern. Exposure sites that we're concerned about through traces, the sewage surveillance, Wilcannia, Burke, Parks, Mudgee and Lennox Head continue to be of concern because through this surveillance previously, we've been able to identify those particular cases. It's great to see in Tamworth and Armidale no new cases. And of course the threat that's coming out of Canberra with the outbreak in Canberra, with another case in Canberra overnight, does put some strain and pressure on the southern part of this state. That's why together we were able to make this decision in relation to locking down the regions. Can I also say that in Wilcannia, where we've had an area of concern, it was great to see the Royal Flying Doctors get in there yesterday, 320 vaccinations. They'll be there for the next couple of days, and the focus on those vulnerable communities will continue by the resetting the resources of New South Wales Health. To everyone in regional rural New South Wales, my message is clear, is to stay home. Of course, there are reasons you can leave for work, for medical appointments, of course for groceries. But the reality is if we do the right thing in the next 7 days, this lockdown in the regions will be short, sharp, but will be effective in protecting communities going forward. Thank you.
Good morning, Premier. Good morning, Deputy Premier, and good morning, ladies and gentlemen. As of midnight tonight, New South Wales Police will launch Operation Stay at Home. The unprecedented operation will see thousands of police officers from police districts and police area commands across the state working alongside our colleagues from the Australian Defence Force enforcing the strengthened public health orders. 1,400 highway patrol officers will be out and about with their specialist equipment, patrolling back roads, setting up roadblocks, so there is simply nowhere for you to go if you want to breach public health orders. Overnight, we had 529 infringement notices issued for breaches of the public health orders, 29 people charged. Unbelievably, 31 infringement notices were issued to a group of young people who thought it was a good idea to have a public gathering on the cliffs at Clovelly. Significant police resources were used to break up that gathering, and of course 31 infringements were issued. 8 infringements issued to people who thought that they could gather in a residence at Jesmond up near Newcastle. 10 infringements issued to a group of people who went to a barbecue lunch at Blacktown yesterday. I would love to go to a barbecue lunch with my friends and family, but now is simply not the time. We are faced with a situation with the Delta variant, I should say, that spreads across young people, so it's particularly disappointing to see young people involved in breaches of the public health order. We now have a statewide lockdown across the state. We need 100% of people to stay at home and comply with the orders, not 90%, 100%. In terms of regional New South Wales, as I've said before, emergency operations centres and emergency arrangements are up and running across local government areas in regional New South Wales. We are enacting plans that were developed some time ago that we hoped that we would never have to use. Those plans have been designed for specific at-risk communities, and we need everyone to abide by the public health orders, but know that those emergency management arrangements, which include police, health and a cross-section of government agencies, are there to support you through this difficult time. My final message is that police don't want to have to enforce these orders, these additional powers, but we will, and we make no excuse for that. Please stay at home, protect your loved ones, protect your family, do it for them, do it for New South Wales, and we can reverse this trajectory of the current variant. Thank you.
I'm not going to comment. I'll provide some information, and this has been cleared by his family. I can confirm that there is someone admitted to hospital that is 15, and that the cause of their admission, whilst they are COVID positive, is related to another health condition, and the family have agreed that we can indicate that he has pneumococcal meningitis. He's 15. I'll have to chase up the vaccination issues with the pneumococcal vaccine. Yeah.
There are concerns Walgett and they're saying that they've run out of face masks and there's not enough resources on the ground. Have you heard about that? Is anything being done to rush more health resources there?
So can I just say that there's been a whole of government response to the situation in Western New South Wales, and I'd also like to acknowledge the assistance of the Commonwealth. The Commonwealth obviously has a key role to play in protecting remote Aboriginal communities, and they've pleasingly deployed vaccine, and Royal Flying Doctor Service has been doing vaccinations in the Walgett area. I'll follow up the issue about masks. I would not expect that there would be shortages of masks, but given you've raised that, we are having regular teleconferences across all the organisations that are responding, and any issues need to be elevated, but I will immediately address the issue of if there are a shortage of masks there.
I understand that's been closed down because a patient has tested positive. Do you have any details about that?
Look, I don't have any details about that, but there is there is always a lockdown if there is any exposure in that site, but I would have to look into the circumstances around that exposure.
Heaps of people out in the community, only 76 fully isolated. Can the case numbers come down if everyone follows the current settings that are in place, and if so, how long will that take?
This is one of the tightest lockdowns that have been in place, and I think what we need to do is, and I want to acknowledge the support of police in ensuring its compliance. I also want to say to the community that the vast majority of community members are doing the right thing, and I can understand your sense of frustration that we're still where we are. So I just want to say thank you. Thank you for staying the course. But we do need the assistance of police, and I really acknowledge that the increased focus on compliance will assist us. But fundamentally, we are all New South Wales residents and we are all Australians. And this is a time when we have to reach out through our social networks, do all we can with our loved ones and extended family, and get the message about the seriousness of this issue. We are at a fork in the road, and we have to decide what path we're going to choose. And the path I want is one where I see declining case numbers and increasing vaccination uptake. Now, the vaccine will not be a silver bullet. We would not expect any significant effect, and this is really important, because just because you are vaccinated, it doesn't mean that you're immediately protected. You need about 2 weeks, 2 to 3 weeks following vaccination to have any effect. But vaccination is part of the solution to this. It helps us because if a person is vaccinated, there is less chance that they get the disease, particularly if they've had the 2 doses, and therefore it means they're less likely to pass it on to others. And also they're less likely to need hospital care and admission to intensive care.
Dr. Chan, is there any explanation why we're all of a sudden up in the 400 case numbers? Has there been a particular event? Is it particular workplaces? Is it because it's in regional areas?
Can I just also probably draw out to the community that the work that is behind the scenes, we would see escalating case numbers, and you can look overseas and you can see how Delta can spread. So the fact that we've actually held the numbers at the level we have is due to a lot of behind the scenes work, and I want to say thank you to those health staff that are testing people, the pathology providers, the public health team that is working day and night. But we need the community to stay with us. And as I said, I cannot describe my concern level if we do not drive these cases down. And it has been so pleasing to see the vaccine numbers increase, because every person that is vaccinated provides a little bit of protection. But ultimately, we also have to decrease our interactions with others if we are going to prevent the spread of this disease.
So there's no particular reason. So this is no particular reason.
So the transmissions are occurring in households, and they're occurring in workplaces. So my other message that is also, we're asking parents to also not send their children to childcare unless they absolutely need to. So this is a time for us to bunker down, do everything we can to reduce those points of interacting with others. So we're still finding that people are visiting each other, and we're still finding that workplace transmissions are set off. And because the burden of disease is so high in the communities, people are providing disability services or aged care, freight, and so we are setting off workplace transmission. We have to break that cycle, and everyone has a part to play in breaking that cycle of transmission. And as I said, I'm incredibly grateful that we are getting this vaccine. And can I just acknowledge my colleague, Dr. Susan Pearce, who has been working tirelessly as part of her team to make sure that we get those jabs in arms in the right group targeted to those local government areas over the next 2 weeks. And that is a mammoth effort on top of the already existing vaccine rollout that is underway.
Some of the measures that we've seen imposed in the last couple of days are not new, not unheard of measures in the past. There have been things that have been suggested previously, but the government has not adopted them, like, for example, the statewide lockdown. Should we have done some of these things earlier?
I think that, look, I provided advice about the need for a statewide lockdown following the briefing yesterday, and that's clearly needed because of the emerging case numbers in the regions. I think what's most important at the moment, at this point in time, is for the community to focus on the challenges ahead of us. We have a choice at the moment. And the choice I'm urging the community to do is stay with the health orders, redouble your effort, do not take risks, protect your loved ones, and just hold with us with an intensity over the upcoming 2 to 3 weeks, whilst we work with police in a whole of government framework to try and get the case numbers. Some of the initiatives yesterday I'm incredibly pleased about, in terms of the isolation payment. So again, there should be no reason why anyone even second guesses having a test, because there is a payment that can be provided to people in those affected areas to isolate. And there is welfare support. There are a range of initiatives that have been put in place, and I'm just pleased that they're in place. We need to see the numbers go down.
Those pleas you've made to people are the same as you've been making for 8 weeks now, and we're still where we are. This many cases, more than 500 people fined yesterday not doing the right thing. Are there any more tools left in the toolkit? Are there any more restrictions, any more orders to make things better, or is this the best that can be done?
I think that's a choice for the community. And what I'm saying is it's a very, very bad picture if we don't make that choice together. And everyone has a role to play. And I'd also just do a big call out to industry. I mean, industry needs to step up over the next 2 to 3 weeks, support their workers getting vaccinated, and also look at what they can do to reduce any COVID risk in their critical infrastructure and manufacturing. They need to, everyone has a part to play. This is not something that government can solve alone, but I'm laying it out there. This is a choice, and I am urging the community to take the path where we see increasing vaccination coverage and declining case numbers. Otherwise, the outcome will be so serious.
What's an update on hospitals, in particular hospitals in the local government areas of concern? Are they coping, or are you starting to see widespread problems now?
Look, the health system is under stress, let's be frank. But it is a big health system, and we have got the capacity to draw on services and staff from a broad range of places. So we have got a level of resilience in our health system. And the other thing I would like to say is if you need urgent care is available to you. So please never think, oh, they must be so busy, I'm not going to go there when I've got chest pain. That's the last thing we want to see at this moment. So please be reassured that the health system is ready and able to respond to your health needs.
The Prime Minister seems to have suggested today that he asked you to shut down the state last week. Was that the case?
Oh, can I say what I'm about to say is the absolute fact? Yesterday after the press conference, I went upstairs for a briefing with Dr. Chant. She provided me with additional advice. I shared that advice with the Deputy Premier, and we then moved to lock down all of rural and regional New South Wales. Because, to be frank, by yesterday, most of the state was in lockdown already. It was just a few local government areas in rural and regional communities. And please know that in a pandemic, you have to act on the health advice you receive. We also had received advice yesterday about many people moving from the ACT down to the southern parts of New South Wales, which was a concern given what's happening in the ACT. And so that advice was provided to me yesterday, and we took that advice immediately.
Doctors are talking about a fork in the road. We've all got choices. We've all got to get on this together. Otherwise, the choices will be very serious. Given that, are you still honestly thinking about easing some restrictions for September and October with cases so high? Honestly, we can't do that.
Can I say yesterday was an absolute wake-up call, and as Dr. Chant has said, we can't stress enough that we don't want to go down the path of all these other places overseas where they have literally thousands and thousands and thousands of cases a day. That's what Delta is doing to communities that have much higher vaccination rates than we do. So it is our opportunity to have a forward path for Australia which is different to what's occurred everywhere else. That's why we're really begging people to take this seriously, to please know that to protect yourself and your loved ones and to protect our freedom moving forward. If you want freedom moving forward, just do the right thing. Stay at home. Stay home, get vaccinated. That's it. So can I say to everybody in New South Wales, the future is in our hands. Together we can do this. I mean, to know that today's numbers, I mean, one day is not a trend, but it's 50 less cases today than yesterday. The future is in our hands. We have the choice to do the right thing. We have the choice to follow the rules and to get vaccinated. And a combination of following the rules and getting vaccinated will help us get to where we want to be in the time frame we want that to happen. But the risk is that if too many people do the wrong thing, the trajectory New South Wales and Australia will follow is what's happened overseas with thousands and thousands of cases every day and so many deaths. We don't want to see that happen. We want our people to feel safe, to be safe, and to avoid hospitalisation. And that's why we're asking everybody to do what's asked of them. We know it's hard, but we are literally all in this together. And it's through the combined efforts of our community, of business, and of course our health and police that we can achieve what we need to achieve.
There's been a case in Sydney of a man, his pregnant wife and children being ordered to leave their home and go into special health accommodation because a doctor has essentially decided that he was not likely to follow the health orders. Is there any concern there might be some overreach happening?
I'm not concerned about that at all. In fact, Health has been adopting that policy for some weeks. I will get Dr. Chant to comment on that because it's a specific policy we put in place to make sure, again, that unfortunately it's not always the rules that are the challenge, it's the fact that people choose to break them. And we don't want people making those bad choices. Those bad choices leave all of us in a situation where we could face a trajectory of increasing cases, not diminishing cases. So in order for us to reduce our cases, we need people to do the right thing all of the time. And we also need to make sure that we take every measure we can to ensure people are doing the right thing. But there is a policy in place which is asking people to go into that special accommodation. I'll get Dr. Chant to make a quick comment about that.
So the community should be rest assured that public health doctors are very caring, compassionate, and believe that most people do the right thing. So that's our starting premise. I think the pandemic has shown that that a small proportion, and let me say it's a small proportion of people, there are also considerations that with Delta, isolation in certain settings is particularly unsafe. So I actually don't like people in apartment buildings with Delta variant. Just because you've got to think about all the things about how do you get rid of your rubbish, where do you go in, how do you access certain groceries, how do you survive. So we've had learnings about Delta that is much more transmissible than the previous strains. I can't comment on the specifics of a case, and I would never air that publicly, but I can just give an absolute commitment that we have been right throughout this pandemic doing what's called a Section 62 order, and our public health clinicians have been applying good common sense and judgment, and can I just acknowledge the fact that the police respond very promptly, and that allows us to allow people to have secure accommodation. And also, so I think that's all I can say is that we would never use that tool inappropriately, but I can't comment on the specific circumstances.
In this particular case, the person had been staying at home. A police check confirmed that a couple of days beforehand. So, again...
Look, I'm not going to prosecute the specifics of a case in the public. It's not appropriate to have that information aired. I can just be confident that our public health doctors do not issue Section 62s for no reason, and there will be a variety of reasons about whether people are in a safe enough environment, whether there's other contextual reasons why we don't think that they can actually be fully self-contained in that area, and then in some cases it might be compliance issues that people are worried about. So a range of factors, but the public health order requires us to form a view, and our doctors take that responsibility seriously in doing those orders.
Has anyone requested accommodation in a special health accommodation but been denied that request? Do you understand?
We are increasing the accommodation footprint. As you can see, case numbers have been increased and we've had to prioritise, but work is being done to increase access to accommodation, and certainly in our regional towns there's also been accommodation stood up so that people can safely isolate.
The people moving from Canberra to the south coast, have we seen any evidence of cases or detections on the south coast to indicate there may be an issue there?
We are monitoring the sewage, and I just want to acknowledge the role of local councils in assisting us with that. So we will keep the community updated if there is anything to be concerned about. But I do urge everyone to follow the rules and get tested. And people that have fled do still need to comply with the stay-at-home provisions regardless of where they are, and given the state's in total lockdown, that again provides us protection, and that's part of the rationale for why we did that as well.
Is COVID zero gone now at this point? We can't get it down low. Essentially all of the domestic borders are going to be closed to us perhaps beyond Christmas if we can't get this under control. Is COVID zero gone?
I think what we need to focus on is what Dr. Chant and myself have been saying right from the beginning of the outbreak, is we want to be in a position where we get down the case numbers as low as possible. In particular, we want to see the rate of people infectious in the community go down as much as possible, and that's been our position right from the outset, and I can't stress that enough. But what I also do want to stress is this is a time when all of us have to take stock and take the situation for what it is. We cannot afford to have too many people do the wrong thing, and as we've said, the vast majority doing the right thing. But if too many people make the wrong choices, we could be on a trajectory of thousands of cases a day, which is what happens around the world. And we can't afford to do that because it would mean more deaths, more hospitalisation and more stress on our system. So I just want to stress this point, that I think when you look around Australia at other states who have lower case numbers than us, it's very stubborn to get those down. It's very stubborn, and we are doing everything we can, throwing everything we can to make sure we achieve those outcomes in New South Wales. But our aim is to have case numbers as low as possible and to have vaccination rates as high as possible. And with Delta, the experience of Delta is that no other jurisdiction has been able to eliminate it. It's not possible to eliminate it completely. We have to learn to live with it. But the best chance we have to live with it freely and safely is to get the case numbers down as low as possible. We can't afford to have infectious people in the community without us knowing about it, because that means you could have an outbreak any day, any time, and that will cause massive hospitalisation and death if people aren't vaccinated. And that is why we have a dual strategy in New South Wales. Get those case numbers down, vaccination rates up. We have to achieve both in order for us to live freely into the future. But I think all of us accept that completely eliminating Delta is something that is near impossible. But what we desperately need is to get those numbers as low as possible to make it safe. We can't afford to have a high number of cases at any stage, because as we've seen overseas, it takes off very quickly in communities which have higher vaccination rates than we have. And certainly we have a lot of work to do, but I'm absolutely convinced we will get there. We've been through difficult times before. New South Wales pulling together will achieve the outcomes if we all do it together, and I'm convinced we will. We've done it before. We've been in situations, in very difficult situations before, and we didn't have the tool of the vaccine. Now, the vaccine isn't the be-all and end-all, but it's such an important tool we have now we didn't have before. But as Dr. Chant has said and I have said, don't assume because you've had a jab that you're safe. It takes at least 2 to 3 weeks for the impact of that jab to take effect. And even when you're vaccinated, it doesn't mean you can't get it or you can't pass it on, but certainly it keeps people out of hospital, it keeps people alive, and it reduces the chance of the spread. So please take all of that on board.
Does that mean, though, that we're likely to stay in lockdown, in Greater Sydney at least, until October when we have that 80%?
Oh, look, it's pretty obvious that, as I said before, that we are looking for what opportunities we can provide our citizens in September and October. As I've said, we cannot expect to live life freely before the outbreak until we at least hit 70% both doses. I've been very clear about that, and 80% 2 doses. That is what the Doherty report says. That is what all of us supported at National Cabinet. However, if we hit those 6 million targets, there are opportunities for us to consider what is safe to do in September and October that we can't do today. Many, and I make this point, a lot of the lockdown provisions in New South Wales are harsher than what we had in other parts of Australia. People currently, there's a number of things people can't do now, but if there's a safe way to do that, if people are vaccinated, we will consider those options, and that's what we've asked Dr. Chant to give us advice on, and that is dependent on us getting those high rates of vaccinations, but also having confidence that this thing isn't going to take off. So we need people to work together with us to make sure we don't have a trajectory of increasing cases, we actually get that down, and that we also keep those vaccination rates up. But me, as well as members of the team, are very keen to see us provide additional things you can do in September and October in a safe way if you're vaccinated. If you're vaccinated. They're opportunities we're exploring currently. But of course, that's also contingent on us making sure that this doesn't take off. Now, that's why it's important for us to make sure in the next few days that we don't see the trend go the wrong way, that we continue to see a trend where case numbers are declining, not going up.
Stop it taking off, but isn't it realistically out of control at the moment, given everything is being thrown at it and we're still seeing
Well,
these
I'm
numbers?
pleased to say, and this is very important, and I want to thank our contact tracers but also our police. In those 2 main local government areas of concern, which had a huge increase of cases earlier on in Fairfield and Canterbury Bankstown, whilst in both those areas we're still seeing additional cases, we're seeing massive stabilisation, which means there's not a rapid increase in cases in those areas. Now, that's been a concerted effort of vaccination. Those 2 local government areas had vaccination rates of only in the early 20s. Now at least 40% of people in those local government areas have had 1 jab. But we also know through the feedback from police, because of the work that's been done, the streets are bare, people are doing the right thing. And we just need that to continue now in those new areas of growth which Dr. Chan has identified. We are very concerned about those suburbs in Western Sydney that we've highlighted in places like Marylands, in Mount Druitt, in Marryong, in Blacktown. These are areas now that are at the greatest risk of growing and spreading. So we know what works in those previous local government areas, and we're obviously redoubling our efforts into those areas. A targeted strategy is so critical. And please know that whilst we get up here and talk every day at 11 o'clock, in the remaining 23 hours of the day, there is concentrated work going on to specific communities through specific leaders, through every avenue that we have to get those case numbers down, and that work is ongoing. We've learned a lot about what is working the most, and we'll be applying that, of course, to those additional areas of concern. But as you know, New South Wales is a big, beautiful place with many diverse communities, and the situation in Western New South Wales is very different to what we're facing in Western Sydney. Both very critical pieces of work, but both which require targeted strategies. And whilst all of us are subject to rules to stay home and to get vaccinated, we also have to make sure that in particular parts of our state, we have strategies that are going to work for those specific needs.
Suggestive, given what the Deputy Commissioner told us about, the cases of people not complying, that our fate now lies in the hands of people who don't care or won't comply with the health order. That may not change ever.
Well, that's why we're asking people to take notice, because what you've said is absolutely the case. We are so grateful to the vast, vast majority of people who are doing the right thing. But Delta doesn't leave any room for error. Even a handful of people doing the wrong thing creates absolute havoc. And I can't tell you how many occasions Dr. Chan has briefed us where one or two people who've moved around in particular ways have caused havoc across a number of local government areas. And unfortunately, that is what Delta strain is like. It only takes a handful of people doing the wrong thing, and that's why the role of police is so critical. That's why we've always said to the New South Wales Police, from the Commissioner to the Deputy... That's okay. It's okay, don't worry. I won't dob you in. Nobody at home knows who that was. So getting back to the serious issue I was talking about, which I slightly forgot. What was the question? Oh, yeah, sorry. So, no, that's okay. So the point is that it just takes a handful of people doing the wrong thing for things to take off. Delta does not leave any room for error. And I say this as a way of comfort, but also as suggesting how high the risk is for New South Wales at the moment. In many places around the world with similar populations to New South Wales, and many states across Canada and North America and also in Europe, populations the size of ours have thousands and thousands of cases a day, and it didn't take them long to get to thousands and thousands of cases a day. Now, I remind people, when we went into lockdown, we had 11 cases with 17 cases overnight. That was the number when we went into lockdown. And look where we are now. So I just say to the people of New South Wales, as you all know, the risk of this taking off is great, and that's why it's so important for us to do the right thing. Because strict lockdown, people doing the right thing and getting vaccinated is a tool we have to get us where we need to go. And I'm confident we will get there, because we've been through many difficult times together, and we will get through this together. And I'm confident enough people will do the right thing, not to afford us setbacks, not to cause all of us grief. And I have faith that people will do the right thing, and that faith has to be backed up with stronger compliance through the police force, stronger efforts for all of us. If you know that extended family members or friends are doing the wrong thing, call them out. And pleasingly, as Deputy Commissioner Willing reminds us, as Deputy Commissioner Warboys has, thousands and thousands of people are ringing Crime Stoppers every day and giving police great leads. Keep that up. As soon as police know or visibly see somebody doing the right thing, we have to go down hard, because otherwise that can set all of us back.
Just to clarify though, if cases say 400s to 300s, will you still consider easing some restrictions if we hit that 6 million vaccination target?
I think it's really important to say to the community, we need the case numbers to come down, we need vaccination rates to go up, but at the same time we are exploring opportunities as to what is a safe thing to do, or what are safe things to be able to do in September and October, because they will be the most difficult time for us. Until you hit 70% double dose, which is the end of October on the current trends, and 80% double dose, which is mid-November on current trends, we need to consider how we can live as safely and as freely as possible in September and October. And that is a challenge for us. And I've asked the team has asked, the team, no. Can I be very specific about this? We need to keep case numbers as low as possible. We cannot live freely, right? Just because you can do one additional thing doesn't mean living freely. Living freely will not be upon us until we have low case numbers And until we hit 70%, 80% double doses, and I can't stress that enough, it is a combination of things that we need. There is no way that I would take any decision as the Premier of this state which is going to cause unnecessary death and heartache for the people of this state. And on that basis, all of us need to work together to get those case numbers down and to get vaccination rates up. And I can't stress that enough, but I have confidence in the people of this state to be able to achieve both. We've already seen people come out in droves to get vaccinated. We've already seen communities respond in ways they never have. But we need everybody to do the right thing, and we need everybody to respect the rules we have in place, and we need everyone to also appreciate the importance of getting vaccination to save lives and keep people out of hospital.
At the start of this, we were targeting no cases infectious in the community. At the start of August, we were targeting vaccination rates of 70% double dose across the community without any regard to cases. Then we were talking about high vaccination rates and low case numbers. Now you're sending a very clear message that we need to get case numbers down. You said we can't afford to have high case numbers at any stage. So what's the target, and are we still going to look at November for easing of restrictions even if case numbers are still high?
I think I've answered that question quite a few times, but I will say this. As Dr Chant said, we are in a very serious situation in New South Wales. Our future is in our hands. The future of our nation is in our hands. We have the opportunity to reduce case numbers, to get vaccination rates up. The vast majority of people are doing the right thing. I'm very encouraged by the number of people coming forward to get vaccinated. Can we just say thank you for that? Dr Chan and I always get pleased when we see those numbers ticking over every day. But what gives us heart attacks every day is seeing the trajectory of those cases go up in certain communities. And we can't afford to let that happen. That has to come down. Please stay home. Do not leave home unless you absolutely have to, and please get vaccinated. And together we will get through this. I have absolute confidence in that. But enough people have to do the right thing all of the time, and I'm convinced we can achieve that. Thanks, everybody.